Nigeria, Africa's most populated country. Blessed with abundant natural resources. It is amongst the world's leading producers of petroleum and home to one of its largest natural gas reserves. Yet, in this land of plenty, many Nigerians still suffer extreme poverty. The country is ravaged by a host of health problems, including HIV, malaria, and diarrheal disorders. Clean drinking water is scarce. Good healthcare facilities are few and far between. A lack of qualified surgeons means that even simple operations, like cataracts, often cannot be performed in sufficient numbers. Yet Nigeria possesses the ability to turn this grim picture around. The government's reforms and programs in healthcare delivery give confidence that Nigeria can indeed successfully implement such projects. And if Nigeria were to be successful in this movement, it could become a beacon of hope for the rest of Africa. This is the goal of the Tulsi Chandrai Foundation. TCF is a charitable trust established by the Chandrai family and like-minded donors. It addresses Nigeria's most vital healthcare issues and through its projects brings hope to hundreds of thousands. In Nigeria, TCF implements 3 projects: the Mission for Vision project, the Mission for Primary Health project, and the Mission for Water project. Through its Mission for Primary Health project, TCF is providing essential frontline medical care, especially for mothers and children in deprived rural areas. Scarce and expensive medical facilities force rural women to trek many miles to access basic medicines, while not being sure about their genuineness. The project began with the aim of providing high-quality, affordable healthcare to the community right at their doorstep. The model for these projects is simple yet effective. At the grassroots level are health posts. These posts are established in outlying villages and provide immediate care for the surrounding population, serving about 2,500 people each. These health posts are grouped into clusters of 10, with each group overseen by one of the 3 or 4 health clinics, each located in a government facility. In turn, these health clinics are managed by the Primary Health Center in a government building. By training local people as caregivers and health workers, TCF is helping make the local community self-sufficient and actively laying the ground for a sustainable future. Supported and supervised by government staff in health clinics and primary healthcare centers, local health workers provide essential door-to-door, village-to-village services, ensuring that healthcare and education reaches the most needy. This means devastating diseases like HIV and AIDS are dealt with at the critical grassroots level.
They have developed a strong relationship with each family, and the health situation in the villages has been transformed. Local people have confidence and trust in TCF because they are committed to improving health conditions here for the long term.
Having built the trust of the local community, already the Mission for Primary Health program has delivered quality pre- and postnatal care for Nigeria. It has ensured the safe birth of thousands of children, seen significant reductions in maternal mortality, and dispenses genuine medicines. TCF is now spearheading a successful campaign of awareness and prevention on this sensitive issue. By targeting reduction in infant mortality, improving maternal health, combating HIV, AIDS, and malaria, TCF health programs address key Millennium Development Goals.
Since I joined this project, to God be the glory, we don't have infant death, we don't have maternal death. In the years back, they used to complain the stillbirths. But now we don't have stillbirths.
Primary healthcare has tremendous scope to improve, leading to dismal health indicators. In 1993, TCF was invited by the community to start a health center, which evolved into a primary healthcare program in 1997. Previously, the nearest health center to the village was 5 kilometers away. TCF's project is conducted in partnership with the community, where TCF provides managerial and some financial inputs, and the community provides the infrastructure and active participation. A successful model that was replicated in Osun with UNICEF support, and in Kaduna in collaboration with the National Primary Healthcare Development Agency, local and state government.
The Mission for Primary Health project began by setting up pilot projects in Eniosa, Adana, Isu, Yola, and Kachia. Encouraged by this success, TCF entered into a technical collaboration with the Cross River State Government to bring primary health care to the entire state. This project now covers a population of 3 million in 18 local government areas.
My first request was that they should partner with Cross River State, but not in one local government or in one community. I wanted TC Chandrai to work with us in achieving or revisiting this vision across the state. Initially for TCF, it sounded like a tall order, but I assured them that I was committed and the political will was there to ensure that we give them the support and the partnership to reach as many cross-riverians in very rural communities who needed these services.
Referral system has been strengthened by creating 18 basic emergency obstetric neonatal care center in 18 comprehensive health centers and 11 comprehensive emergency obstetric neonatal care center in 11 general hospitals. In terms of quality care, the skills of the doctors and health workers were upgraded by training and capacity building. 1,882 community health extension workers had their capacity built and their skills in midwifery upgraded. The funds from Nigeria Governor's Immunization Leadership Challenge Award was used to train 276 midwives and 14 doctors in emergency obstetric care, the use of non-pneumatic anti-shock garment for postpartum hemorrhage. Using the same fund, 1,200 traditional birth attendants were trained in home-based midwifery skills and referrals. In all, it is crystal clear that 5 years down the line, when the government of Cross River State, led by Senator Lielimoke, signed the MOU with TCF for the execution of the blueprints for the PHC program, Cross River State is now better and boasts of one of the most effective designed and implemented PHC programs across Nigeria.
TCF, along with the Cable Ram Foundation, has now set up another primary healthcare center in Zaria in Kaduna State. TCF would like to build such partnerships with all 36 of Nigeria's states.
In the name of TC Chandrai Foundation, it is purely a health revolution in the sense that it is targeted at the poor masses. It has made health not just affordable, but accessible to our people.
The collaboration between the Kebbi State Government and TC Chandrai Foundation is a good example of private-public partnership. So it is a good example for other organizations to emulate.
I think that if we can replicate this model all around the country, we'll be better for it, because it's basic, it's simple, and it addresses the real problem of the people.
TCF's vision, right when it started, was that every Nigerian should have access to primary health care, clean drinking water, and good quality eye care. My dream today is one day every Nigerian will have these facilities.